The following video was originally recorded Friday night during the Liberty Uncensored live stream. Since the airing of that stream, the United States Fifth Circuit Court of Appeals has issued a temporary stay on the new OSHA rule, both delaying its implementation and forcing it to undergo judicial review. Some outlets, like the Washington Post, are blaming the three-judge decision on Republican judges, but the reality remains that it was in response to questions of constitutionality brought on through lawsuits from several states. The temporary stay gives the DOJ until 5 p.m. today to respond with a more permanent halt to the mandate while the courts take a closer look at the rule. The following video is not meant to be or provide medical advice, YouTube, and is simply a summary of the 490-page OSHA rule. The Biden administration unveiled a sweeping federal labor rule on Thursday requiring private employers with at least 100 employees to assure that all of their employees are fully hokey-pokeyed against COVID-19 or submit to regular testing and wear a face mask. This is the mandate that he said he was going to put out. This is the mandate that we saw in the Hornady video. And some of the other companies out there that have been saying that they were going to be subject to a mandate, but they didn't have the details. This is that mandate with the details. OSHA announced that it is issuing this as an emergency temporary standard, which requires all employers with 100 employees or more to require that all workers be fully hokey-pokeyed against COVID no later than January 4th or face stiff financial penalties. The OSHA rule, which applies to most of the U.S. workforce, I believe it's about 2/3 of the U.S. workforce, requires any employee who chooses not to get hokey-pokeyed to submit to weekly testing for COVID and to wear a face covering while on the job. So that would be even if they're testing negative and the job knows that they have tested negative and they do not have COVID, they will still be forced to wear a mask while at the workplace. There are a couple of exceptions to this. They have in this version an exception for remote workers who never step foot in the office. They have an exception for people who work exclusively outside. And there is an exception for eating, drinking, or if you are alone in a tiny little four-walled office with a door. They specifically say a small space with like 4 walls and a door if you are alone. But OSHA is already talking about how this is really going to come in phases. So this is phase 1. Phase 2 is going to be with no exceptions for testing and no exemptions for masking. And phase 2 is also going to include companies of under 100 employees. So this is eventually going to encompass the entire workforce if this is allowed to stand. Now, while this rule is not requiring the hokey-pokey and masks for people working remotely at home, the healthcare one does. That was the other mandate that Biden put in, and that was when he announced this mandate, and he announced, well, OSHA's going to be making this, he also announced the medical mandate that was tied to Medicare and Medicaid reimbursements for healthcare workers. That's something entirely separate. So healthcare workers, even if they're remote, have to be hokey-pokeyed. The rule also allows employees seeking an exemption for medical reasons or who have a sincerely held religious objection to apply for an exemption. OSHA instructs employers to deal with these requests on a case-by-case basis. One of the things that I have seen is if people do seek out a religious exemption, then they have to sign a paper and testify that they won't take Tums, they won't take Tylenol, and there's a list of a couple of dozen medications and over-the-counter treatments, because a lot of what the folks are using as the religious exemption is that Fetal cells have been used in the testing of the Hokey Pokey, and that's kind of what they're going on for the religious exemption. And so a lot of employers are now requiring people to swear an oath that they won't use any other medication or treatment that has ever utilized fetal cells in the mechanism of the medication or the testing or creation of the medication or treatment. So the government's definition of full Hokey Pokey is anyone who has received 2 doses of either the Moderna or the Pfizer mRNA Hokey Pokeys, or 1 dose of the Johnson & Johnson Hokey Pokey. Keep in mind that they're talking about 3rd and 4th shots as boosters, and so it's entirely possible that at some point the federal definition of a full Hokey Pokey will also include all of the booster shots. Does this OSHA ETS affect healthcare workers? So the Centers for Medicare and Medicaid Services issued a separate rule on Thursday that requires any healthcare employee who works in a facility receiving Medicare or Medicaid funding to receive the COVID Hokey Pokey. Unlike the OSHA rule, this mandate has no exception allowing for testing. None at all. So that means we are going to see, I am sure, a lot of walkouts of healthcare workers. And we've already seen when the Hokey Pokey mandate was put into New York, how there was that hospital labor and delivery unit that had to shut down, how there were urgent care centers that had to shut down because they were losing so many workers, to the point that the governor signed a little executive order giving herself full authority to call in the National Guard to replace those people. Did a couple videos on that. And that was just in one state. Imagine on a national level. Now, who pays for the Hokey Pokeys or the testing is also an excellent question. So the OSHA regulation requires employers to give un-Hokey Pokey workers paid time off to receive the Hokey Pokey, which are available at no charge, as well as to recover from any side effects that the Hokey Pokey may produce. Notice that this isn't for any other Hokey Pokey. This isn't for the flu shot. They don't do that for anything else. It's only for this specific Hokey Pokey. Who pays for the testing is pretty much unclear at this point. So the Biden administration allows employers to force employees to get their own tests. Testing kits currently run between $11 and $15 each, so a worker could spend a minimum of $572 a year to remain in compliance with the Biden administration's edict. I believe that is either with insurance or if you get the over-the-counter tests, because I have seen some people go into testing centers and have to pay $150 a pop. So it could be a minimum of $572 a year, but say that they are one of the folks that for whatever reason have to pay $150 a month times or $150 a week per test times 52 weeks, that is $7,800. So minimum of $572 a year, but as much as $7,800 per year for testing that is required under this OSHA mandate. There is no way that all the employers out there are going to be paying that per employee. I mean, maybe if they get some kind of like kickback deal or something with some company, maybe, but I doubt it. NPR said the move appears designed to push workers to choose Hokey Pokeys over testing. Absolutely, that is nothing new, trying to hit people in the wallet. But speaking about hitting people in the wallet, check this out. The cost if employers refuse to comply with the mandates. If employers of 100 employees refuse to comply with the OSHA mandate, the Biden administration may impose fines of up to $13,653 very oddly specific dollars per violation and $136,532 again oddly specific dollars for willful or repeated violations. So a willful violation would be if a company says, well, we're just not going to comply. So theoretically speaking, you have a company that says we are not going to comply with this, and we'll give them the minimum of 100 employees. So that would be considered a willful violation of $136,000, 532 per violation. A violation is an employee. So if there are 100 employees that say, nope, we're not complying, our company says we don't have to comply, so then you take that dollar amount times 100, that is $13.6 million that company of 100 employees would be fined for not complying with this rule. They're telling employees, comply or lose your job. They're telling employers, comply or we are going to bankrupt your company so that you can't have it anymore. This does put companies in a really hard place, and we saw a lot of folks buckling and folding under this before they even knew what the rule was. Now with this, we are going to see a lot more companies fold. I can guarantee it, because they're not going to want to lose this kind of money per person. So it's really going to become a case of like, put out or shut up, where companies are either going to fold or file a lawsuit and say that they're waiting for the fallout from the lawsuits. Several states are filing lawsuits. Daily Wire has filed a lawsuit, and they're all swearing to take it all the way up to the Supreme Court. And because there actually is no legal precedence for this, and because of the way that the rule is written, which we'll get to possibly with the Reason article here, but the TLDR version is, OSHA says that without this rule, unhokey-pokeyed employees face grave danger in the workplace, and so this rule is needed to protect them from grave danger. So that kind of puts them in a position where legally they have to prove that unhokey-pokeyed employees are facing grave danger from themselves by choosing not to get the hokey-pokey. That could be pretty difficult to prove legally. We shall see. It'll be interesting to see how all of that turns out. Also, OSHA has a track record of being really, really, really bad at defending their own rules when they get taken to court. So that is also something to consider. Here is the little tidbit about remote workers. It does not apply to remote workers and people who work outdoors or in isolation. They are exempted from this rule. OSHA states that its rule does not apply to employees who do not report to a workplace where other individuals such as coworkers or customers are present, employees while they are working from home, or employees who work exclusively outdoors. But again, this is different from the medical rule. So this does not apply to medical employees. These are just regular old non-medical private sector employees. So private businesses of the scale discussed in the ETS employ an estimated 84 million people. According to the Biden administration, the CMS rule, so that is the Medicare-Medicaid rule, apply to an estimated 17 million Americans who work in over 76,000 healthcare facilities. So this together is the 2/3 of the U.S. workforce that I quoted at you guys. Now, how many companies currently have mandates? This says it's impossible to know, but a recent survey of more than 1,000 companies found that only 13% currently required all employees to be hokey-pokeyed, while 66% said their employees are not required. We will see if that still stands now that they see the amount of money they could stand to lose. The way that this would be enforced is that companies are going to be required to throw HIPAA out the window and ask employees about their status, get proof of that status, log that status, and keep updated databases about that status that OSHA is going to send people in to check on and audit. So OSHA is going to literally send people to companies of 100 employees or more and check their records and check their databases and check their reports to make sure that this is actually happening. So I think that we have a twofold issue here. Number one, we have the government looking for more control, which they always do, but also they're looking for money. This is a money grab. If we consider that figure of a standard little 100 employee company and a willful violation per employee and that $13.6 million, that will add up quick. And of course, as I mentioned earlier, Secretary of Labor Marty Walsh, good old ex-mayor of Boston, was the official that was tasked with overseeing the mandate. And he said, again, that it isn't a mandate. He added that those opposed to taking the Hokey Pokey should take a deep breath because the federal government imposed the sweeping new top-down rule in order to keep them safe. So at this point, anyone who wants to receive the Hokey Pokey, ages 5 and older, are legally eligible to do so. And there are plenty of places that they could do so at this point. So at this point, if you have not had your Hokey Pokey, you probably don't want the Hokey Pokey and you have made that choice. Well, he is saying that basically this is required to protect you from your own choice. We have here a list from Axios. It should be a full list at this point of all of the states that are suing. So at this point, it is more than 15. It says, across the U.S. have filed lawsuits against the Biden administration over its federal vaccine mandate for companies with at least 100 employees. Hokey Pokey mandates. Sorry, YouTube. More than 15 states are filing against the Hokey Pokey mandates. So, attorney generals in 11 states filed a lawsuit on Friday against the administration, calling the mandate again unconstitutional, unlawful, and unwise. The states participating in the lawsuit, as of the writing of this article, are Missouri, Arizona, Montana, Nebraska, Arkansas, Iowa, North Dakota, South Dakota, Alaska, New Hampshire, and Wyoming. The lawsuit was primarily brought by 10 Republican attorneys general. Iowa's Democratic Attorney General, Tom Miller, also joined in the suit. On Thursday, there were also 3 other states, Ohio, Kentucky, and Tennessee, that sued the government just hours after the mandate was announced. The plaintiffs say that Biden signed an unlawful executive order, adding that our system does not permit agencies to act unlawfully. Louisiana, Indiana, and Mississippi have also filed a lawsuit and said that the Hokey Pokey mandate suffers from a host of fatal flaws. It says that the mandate usurps state authority, and that is true. The individual states are the only level of government that are allowed to put out any Hokey Pokey mandates at all. And that is something that has lots of legal precedent behind it. It says that the mandate usurps state authority, provides no reasoning whatsoever, and violates a litany of constitutional restraints. Last Friday, Texas sued, even before the actual rule was put out. Indiana's Attorney General plans to file 3 separate lawsuits. One is the one filed with Louisiana and Mississippi, one challenging the mandate for federal contractors, and another against the Hokey Pokey mandate for those working in nursing homes, hospitals, and institutions that receive funding from Medicare and Medicaid. So he is going after all 3. Georgia state officials said that in October, they also plan to file a lawsuit along with South Carolina, West Virginia, Idaho, Alabama, and Kansas. And of course, DeSantis over in Florida said on Thursday that the state will also be filing a lawsuit against the administration after the mandate is published in the Federal Register. This is just the start. This is in the 24 hours, really, give or take, 24, 36, since the mandate was officially put out into the ether for people to see. And OSHA's poor track record in defending prior emergency standards suggests this one may be legally vulnerable, according to Reason magazine. And the reason for that is that it covers, again, 2/3 of the nation's private sector workforce, and it says that it will protect more than 84 million workers from the spread of COVID on the job, and that the disease poses a grave danger, quote, to employees, and immediate action is necessary to protect them. So that is part of what's going to be challenged in court, is that wording. The language tracks the statutory requirements for an ETS, which bypasses the usual rulemaking process, allowing OSHA to impose regulations that take effect immediately. OSHA's determination that COVID in the workplace qualifies as a, quote, grave danger is subject to judicial review, and so its assertion that the specific policy it chose is necessary to address that danger. The courts could say, well, if this is such a grave danger and is absolutely necessary, why are you allowing any exceptions at all? So that is another lane that could be taken here, such as the places that don't require masks, and the fact that only the hokey pokey people don't have to wear them, when people with the hokey pokey can still catch it and spread it. That has been established even by the CDC at this point. And then it talks about some of the requirements, that it does not require the actual employers to pay for the testing. If employees have to foot the bill for testing, which might amount to $150 or so a week, that was the number that I gave you guys earlier. So that is a number that's also floating around other places. And that will provide an actual, like an added hokey pokey incentive, they say, even though that's not the official goal. And it mentions the hassle and discomfort of wearing a face mask all day, although officially a safeguard aimed at protecting coworkers likewise will encourage employees to get the hokey pokey because of the stigma. Because employers must ensure that each employee who is not fully hokey pokeyed wears a face covering when indoors or when occupying even a vehicle with another person for work purposes. And again, these are people who have already been tested. We know that they're negative, and they're still going to require a mask in these situations. Legal challenges could argue that OSHA is implicitly conceding that testing and masking of unhokey pokeyed employees is not truly necessary. In the example that OSHA offers, 5% of a company's employees are entitled to reasonable accommodation. In terms of risk, that situation is indistinguishable from a workplace where 5% of employees simply choose not to have the hokey pokey. That is another legal argument that could be used. Really, what it's going to come down to is those arguments, but also whether or not OSHA actually even has the legal standing to institute this kind of rule when it has never, ever been done before. And OSHA is justifying it by saying that the benefits outweigh the unconstitutionality of it, basically, by saying the agency estimates that the rule will save over 6,500 worker lives and prevent over 250,000 hospitalizations among employees over the course of the next 6 months. And it says that the mortality and morbidity risk to employees from COVID is so dire that the grave danger from exposures to COVID is clear. So we'll see if that statement helps them or hurts them in the long run. I suppose Biden could still try to pack the court at this point to get ahead of it. That is a possibility, but we shall see.